on staff at the Champaign County Healthcare Consumers, and I am the lead organizer of the Medicare Task Force. The Medicare Task Force is the group that's responsible for putting together this meeting today. As all of you know, Medicare Part D open enrollment began on November 15th, and it's going to end December 31st. And many Medicare beneficiaries are feeling confused and overwhelmed with choosing a Medicare Part D plan. So the Medicare Task Force felt that it would be useful for our community for us to provide a meeting to provide helpful information and resources for people who are struggling with Part D. And we also wanted to tell you about our campaign to fix Part D and how you can help with that campaign. So everyone should have an agenda when you signed in. I hope everyone got one. It's the white piece of paper in the front, and a pamphlet from the Medicare Rights Center, that's that green sheet, and then a cautious consumer guide, which is the blue one. If you look at your agenda, you can follow the order of speakers for today's meeting. First off, we're going to have Katie Coombs, who is the organizing director of Citizen Action Illinois, and she's going to discuss some issues with Part D in 2008 and offer some tips on how to avoid some of the many pitfalls of Part D. I'd also like to mention that many of you might recognize Katie because she was the Medicare Task Force leader before I took the job, and she moved on to her new organization in Chicago. So it's going to be great to have her come talk about some Part D issues she's been working on in Chicago as well. Then we also have Andrea Butler from Family Service Senior Resource Center, who's going to be speaking to us about some local resources for help in choosing a plan and what Senior Resource Center can do for you. You might notice on your agenda it does say Tricia Morenz is going to speak, but she got sick today, so we were lucky enough that Andrea was able to come and fill in for her. And I'm sure she will do a great job. So after that, Walter Matherly, who is one of our leaders from the Medicare Task Force, is going to offer a short overview of our Medicare Task Force and our campaign to fix Part D. And then I'm going to talk about a piece of legislation that's been recently introduced by our own Illinois Senator Dick Durbin, and it's co-sponsored by another Senator Barack Obama, and that could offer some hope for fixing some of the problems that we have with Medicare Part D. So it's good news. So we'll be excited to talk about that. And then finally, another leader from our Medicare Task Force, Shirley Faulkner, is going to be talking about how you can get involved in our campaign to fix Part D. All right, great. So after that, then we'll just close with an opportunity for some questions, if you have any. And you'll have an opportunity to visit the informational tables we have. Provida Covenant Medical Center is here. They're going to present some information about SHIP at their table, so you can visit there. Family Service has a table here, too, for the Senior Resource Center. And in the back, we have our Take Action table, which Shirley will tell you what you can do later on with our Take Action table. I think I mentioned earlier that the restrooms are just down the hall here if anyone needs them, and there's coffee and snacks in the back, so if you want to get up at any time and help yourself, please feel free to do so. So now I think we're ready. We can begin with Katie Coombs of Citizen Action Illinois, who's going to present her Cautious Consumer Guide and discuss some changes in Part D for 2008.
Good morning, everyone, and I'd like to thank Ann for that gracious welcome, and I'm really happy to be back here in Champaign, seeing some old friends and new faces here. I remember starting the Medicare Part D struggle with people from Round Bar Manor, and we were just learning about changes to circuit breaker and senior care, and really didn't even know what Medicare Part D was, and glad that the community is still at the forefront of knowing what is new and what consumers need to know in order to navigate this confusing program. I'd like to take a few minutes to go over the highlights of the Cautious Consumer Guide. I'm not going to go over each page in great detail because you can read that on your own at home and focus on what is most important to you. But hopefully everyone has a copy of that. And I just want to start with a disclaimer that the guide is not intended to be comprehensive. It's intended to warn people about those potential pitfalls that Ann was talking about, and get you to ask questions about your needs when it comes to Medicare Part D, and hopefully to shop around and find the most affordable, effective prescription drug coverage for you. The first thing I'd like to clear up for some people is that Medicare Part D is only available through private insurance companies. Even though it's called Medicare, there is no Medicare plan. You have to select and enroll in a private plan. This creates a lot of problems with the program because there are so many choices that Medicare beneficiaries are faced with each year. And it contributes to high administrative costs to have all these different insurance plans out there marketing a wide variety of plans. And many organizations like Champaign County Healthcare Consumers and Citizen Action Illinois actually opposed the legislation that created Medicare Part D because it didn't benefit consumers enough, while it guaranteed enormous profits and a steady flow of customers to private insurance companies. And the competition that was so lauded in the Medicare Part D beginning has failed to do what it was supposed to do. They said it was going to keep costs down, and it did not. If you want to look on page 4 in the consumer guide, you can clearly see that the donut hole, which is a terrible thing that's been built into the program, is actually a period of time in the Medicare benefit where people are paying their monthly insurance premiums and 100% of their prescription drug costs. This period of time has grown by $1,000 since the program began. So clearly this competition of the private insurance companies has failed to keep costs down. Medicare is long-term health insurance, and many seniors and people with disabilities approach Part D with the same expectation that they could find a plan to be with for the long term. But these Part D plans change all the time. During the upcoming enrollment period that we're in until December 31st, this is the limited amount of time that Medicare beneficiaries have to change their plans if they need to have an opportunity to find something that better meets their needs after being locked into a plan for the past 12 months, while the plan had the freedom to make any changes they wanted to their drugs that they cover, to the costs. So this is a really important time that we take to look at what's coming up for the next year and try to find the best plan for you. The place to start is to think about, if you have a plan now, how did it meet your needs in the past year? And if you're new to Medicare Part D, think about what are you looking for in a Part D plan. For example, do you need coverage here in Champaign as well as in Florida or another state? These are things that you want to be considering. There's a long list of questions in the consumer guide. There's a lot of ways that you can compare the plans that are out there. And one way that a lot of people have made their comparison is by looking at the premiums. But you cannot judge a plan by its premium. A low monthly premium might be attached to high drug costs at the pharmacy, making the overall cost of that plan actually higher than a moderately priced premium plan with moderate drug prices. And another new development for 2008 that I want to point out is that there's a potential for plans to be charging high prices for generic drugs. The plans are now allowed to subclassify generic drugs into tiers. And looking into this, I found one plan in Florida was actually charging $75 for generic drugs. So it's really important to look at all the details of the plan, not to just focus on those monthly premiums. So all of the people that are currently in a Medicare Part D plan should have received information from their current plan about how that plan is changing for 2008. It would go over all the details of the changes in the formulary, the benefit structure, the costs, and more. So if you haven't received this letter yet, you should contact your plan and figure out how it's changing for 2008. Another area of concern is to be aware of your membership and cost-saving programs, such as the Illinois Cares RX program and the Extra Help program. When you're comparing these plans, there's a lot to consider, and coordinating with those cost savings programs is another area that you want to be aware of. And that also changes every year. So checking to see if your plan is still coordinating with Illinois Cares RX, or if there's more plans that might be available this year, which there are. There's a lot that have been added. Is something that you should really look into. The annual problem of the donut hole has created some more concerns for people with Medicare Part D to be aware of in terms of the cost savings program. One of the big changes to Illinois Cares RX for the upcoming year is that, not to Illinois Cares RX, to all the Medicare Part D plans out there, is that there's not a single plan out there that offers coverage throughout the donut hole period. That is a big change that has led some people to really start paying more attention to the Medicare Advantage plans. And Medicare Advantage plans are a lot more to take in than just the Medicare Part D. Part D is the prescription drug insurance. It's the new thing. We're in the open enrollment period for that now. Medicare Advantage is a whole other story. It's your prescription drug coverage and your health insurance coverage. So for people that have a real concern about those costs that come up through the donut hole and want to find a plan that has that coverage and are looking into Medicare, we really encourage you to use extreme caution and make sure that you know what you're getting into. Is the plan going to work with the doctors that you want to work with? Is it going to work with the hospital networks that you want to work with? And to talk to a counselor about it. Don't simply rely on the insurance agent for that information. Talking to someone that doesn't have any possibility of financial gain through the transaction is really important when it comes to working with Medicare Advantage. And there's been just an explosion of these plans, and it seems up here that there's a lot of example of that. People have been having their mailboxes overwhelmed with information from these Medicare Advantage plans. So there's a lot of them out there. There might be some potential benefits for you, but please do use caution. There's also the opportunity, because of all this information, for these plans to take advantage of people. They employ people that are not full-time staff members. They're working on a contract and they're getting paid by the amount of people that they enroll. So there's a potential for fraud here. They might not tell you everything you need to know. So if you do think you might have been a victim of fraud or you're worried about becoming a victim, the phone number for the do not call list is actually listed in here, so you can place yourself on that list and avoid those annoying phone calls. And if you have something that you think needs to be reported, do follow through and report it to a senior service agency in town, or you can even call the local police to make that report. So, that being said, there is actually a lot of good information that comes through the mail. There's important things from your insurance company. There's important things from the state of Illinois. There's important things from Medicare and from your former employer and union. So do read and open all mail that looks official. And if you have a question about it, contact someone for help to see if that letter is something that you need to be responding to. So your mailbox, there's a lot going on through this period of time. And now I'd like to take a little bit more time to talk about those cost savings programs I mentioned, Illinois Cares RX and Extra Help. The Extra Help program is a federal program administered by the Social Security Department, and it offers help with the costs that come with Medicare Part D. One of the big places where it helps is through the donut hole, because you are protected from the donut hole if you are eligible for Extra Help. Because of these rising costs that I mentioned earlier, however, the monthly premiums of many plans have increased so much that these plans are no longer eligible to coordinate with the Extra Help program. So if you are currently enrolled in an Extra Help coordinated plan, you might want to confirm that that's going to be working for next year. And if you haven't looked into Extra Help yet, I would encourage you to check out that program. You can contact the Social Security Department or one of the social service agencies here in town to learn more. The Illinois Cares RX program is a great program we have here in Illinois that also helps with the Part D costs of the monthly premium and provides protection from the donut hole. The change that I'd like to point out with Illinois Cares RX for 2008 is that there's actually two plans coordinating with Illinois Cares RX, Humana and Silver Script. They're standalone plans that have a deductible for 2008. And what that means is if you're a member of the Illinois Cares RX Basic, if you're in the plan that only covers the 11 disease categories and you need a medication that's not part of one of those covered diseases, in the deductible period you'll have to pay 100% of that drug cost. And so if you're in the plan because you can't afford to pay 100% of the drug cost, then we would really encourage you to select a plan that does not have a deductible if you don't find yourself in that situation and you're able to get access to the drugs that you need. And Illinois Cares RX has been a great program, very helpful for people here in Illinois. But it was created on the fly, like I mentioned earlier in my comments today, to deal with this impending doom of the Part D program. And so it has these two different categories, the basic and the plus, and it really should be one program. And now that we've had more time to reflect on how to coordinate with Medicare Part D, there is some potential. Some legislators in Illinois have talked about creating one program for Illinois Cares RX to coordinate better with Medicare Part D. So if I can learn more about that, I will share that with the Medicare Task Force so that that's legislation that we can think about supporting to improve the coordination between Illinois Cares RX and Part D moving forward. So that's the updates that I have to share about Medicare Part D, and I guess the theme here is it pays to shop around. There are changes to every single plan for Medicare Part B in 2008. You can't trust that your plan is going to change the same. Some of them are sneaky things like generics costing more money. So you can't judge a plan by its premium, even if that seems affordable. You really need to look into all the details. And if you have any questions about the consumer guide, I'd be happy to talk to you after the meeting. Thank you very much.
Thank you so much, Katie. I think that information is really helpful. And listening to it, I just realized, it's really confusing how many different things you have to keep in mind. And I think that's also illustrated. Katie pointed out this table we have here of all the information that you're getting. We asked members of the Medicare Task Force to bring in some of this mail that they've been getting. And only about 4 or 5 people brought it in, and they only brought in a few days' worth because a lot of it they've just been throwing away. So I think that this is just a small representation of, I'm sure, what all of you guys are experiencing, which really just makes sense why this is so confusing and why people really need help in choosing a plan. So I also wanted to include, Katie had talked about how some of these things can be intentionally misleading. One of the mailings in there actually looks exactly like something that comes from Social Security, which I found was very misleading. And some of the phone calls can also be very misleading. That's why I included that green sheet from the Medicare Rights Center. I think it really lists out some of the things that you should be aware of. That they cannot ask for your credit card information over the phone, and if they call you, they can't sign you up. You have to call them and things like that. I really encourage everybody to read that over. And I leave the numbers on the are on that sheet as well if you feel like someone has done something fraudulent when they called you, as well as during Katie's consumer guide. So next, because I'm sure everyone could really use some help now in choosing what their plan is, keeping all this in mind, we've got Andrea Butler, who's going to talk to us from the Senior Resource Center.
Good morning. I'm battling a cold myself, so bear with me. First of all, I'm an outreach worker for Family Services Champaign County, and I deal with everything. We can help with, let's say, power bill of $600 to down to getting some special shoes because your doctor says you need it. That's how wide a range of the things that we do at Family Service Senior Resource Center. We deal with clients 60 and over. We also have a caregiver advisor at our department who deals with grandparents raising grandchildren or children taking care of their parents. And it's a very good part of our department because there's a lot more grandparents raising grandchildren these days. So it's something, if you know anybody, they can utilize that and give us a call. A lot of things that I was going to talk about, Katie has already talked about it, but that's okay because there are some things that I do want to cover. Right now, we're getting a lot of phone calls because our great governor sent out a notice, and people are confused about the notice. Actually, one says it's open enrollment. You need to look into changing your Part D plan if you choose to, and the other one is you need to reapply for Illinois Cares RX. And right now, they're saying that if you have not reapplied by December 1st, it's not guaranteed that your benefits will continue in 2008 without any breakage. There might be a little breakage if you don't. We're encouraging people to call our agency so we can reapply for you online. It's a lot faster and it's simpler for the client and for us to do that. It's just about getting some information together and we can do it online for you. Also, Katie was talking about the different plans, the abandoned plans and things like that. We had an issue last year where a salesperson got into a senior building via one person and was knocking on everybody's door and trying to sign people up, and actually got through with signing some people up, which in turn caused them to get kicked out of some of the programs that were going on, like Illinois Cares RX, because they were saying, well, we work with the state too. Well, they could at that time through the Department of Human Services, but that doesn't mean that they are coordinated with Illinois Cares RX. So you have to be really, really cautious cautious of who you talk to. I don't care how sweet the deal sounds. Give us a call. You know, if you are not sure, and if they keep badgering you, say, here's my caseworker's phone number. That usually scares them off. We ended up having to get the Attorney General involved in this because they just kept on and kept on and kept on. So it's a really frightening thing when somebody can get into a senior building and do that. So you have to be really cautious of that. Same thing when they call. If they keep calling you, tell them this is phone harassment, you know, you can get in trouble for this. Do whatever it takes to secure that you're going to be okay with what you have right now, because you don't want anything to kick you off a plan. Also with, we also help with finding out what kind of Part D programs are out there that are suitable for you. We like to get any family members involved, because if you're not quite understanding what we're talking about, maybe that family member can help you along as well. We give the advice, you know, about what plans are coordinated with Illinois Cares RX. That's the big one, you know, because a lot of people in our community deal with Illinois Cares RX. This is what we're coming across. We also look at what the different formularies are. You know, if your drugs are on that formulary, if there's a possibility that it could go up, go to a different tier, because we've been seeing that a lot. They've been jumping from tier to tier. They might have started off on tier 1 and now they're on tier 3. And that's very frustrating to a lot of seniors because, you know, they're on fixed incomes. So you gotta be really watchful of that, be knowledgeable. Don't be scared to call the insurance plan and say, look, I need to know, you know, is my, you know, drug still on this tier? And if you're not wanting to do that, we're able to do that for you, just to find out if that's still a good plan for you. I don't want to sound like a repeat educator because you touched so much of what I was going to talk about. But the bottom line is that if you have any questions, need any assistance with anything to do with Medicare Part D, Illinois Cares RX, public aid, if it's Medicaid, we are here to assist you. We do those applications. We work very closely with the Department of Human Services in Champaign. They're not so cordial to us at the state level, but we try to get our point across. But we do those applications as well. So we also do extra help applications. We can do those online. That makes it very simple. We can go out to your home and do any of this in your home. If you are not able to get, if you don't have a phone, or if you don't have a computer, or if you don't have a way in, we do home visits all the time. And we service Champaign County. Do you have any questions? No? Okay, that's all.
Thank you so much, Andrea. I know from personal experience, the Senior Resource Center is really great. I've come across people calling me and asking me some questions that I didn't know offhand, and they always seem to know the answer when I call. So I think that they're a really great resource for our community, and I really recommended them when people come and ask me, you know, what plan they should choose. So I encourage everyone to come visit the table and talk to Andrea afterwards and maybe get some information and things like that. All right, next, so we've talked a bit about some of these problems that everyone's encountering with Part D. So I think now it kind of makes sense why we have a Medicare task force that is working on a campaign to fix Part D. So I'm going to ask Walter Manley, one of our leaders from the Medicare task force, to go up here, and he's going to tell you a little bit about our group and our campaign to fix Part D.
My name is Walter Manley. I'm retired, and I'm a member of the Champaign County Healthcare Consumer Medicaid Task Force. Before I start, everybody's got a copy of that, right? I hope you'll read it. And when you finish reading it, read it again. It's a good one. Okay. What is the Medicaid Task Force? I talk too much, so with Katie's help, I managed to cut this back a bit. The Medicare Task Force is fighting for a real Medicare prescription drug benefit that would include at least these 4 things. To be administered by Medicare, because it's cheaper and it's better than the insurance company. To negotiate discounted drug prices. There's an enormous number of people covered by Medicare, and there's a great deal of buying power involved in that, and they don't use it. Third, to eliminate the donut hole. The only donut hole we're interested in is the ones you can eat back there. Increase consumer, meaning beneficiary protections. Now, a little bit of detail on each one. We want the Medicare prescription benefit, drug benefit, to be administered by Medicare with a Medicare-administered program. The confusion, God knows there's enough confusion, over plan coverage, formulary, and the extra cost associated with private insurance would be eliminated, saving the government, taxpayers, and us money. The ideas are there. Second, to negotiate discounted drug prices. Part D legislation currently prohibits, I couldn't believe this, prohibits the government from using the bulk buying power of the Medicare beneficiaries to negotiate for lower drug prices. Allowing Medicare to negotiate for lower drug prices, as the Veterans Administration already does, all right, very successfully, would make prescription drugs affordable. Now, third, eliminate the donut hole. It's coverage that you don't get. You pay for it, but you don't get. In the coverage gap built into Part D, Medicare beneficiaries pay their monthly insurance with premiums plus 100% of their drug costs. Some insurance, huh? Resulting in financial hardship and leaving many people unable to afford needed medications. In the donut hole, Medicare beneficiaries are literally forced to pay for coverage that they're not getting. This is not right and it's not fair. And fourth, increase consumer protections. Part D must include the following consumer protections to be a real benefit for Medicare beneficiaries. A predictable premium cost, fixed drug costs. I mean, the government's got to have numbers in order to have a budget. Coverage of all drugs deemed medically necessary by a patient's physician, not the insurance company's physician. And the elimination of exorbitant and unforgiving late fees, which can eat you up, I tell you. So, that's that, and you'll have an opportunity to ask questions later on. But I'm delighted to see you all here. I want to make sure we welcome Katie back. The next person is, who's the next person?
Me.
Hey, Urbana! Oh.
Thank you so much, Walter. You're so fun to listen to. So I think what Walter said really makes it clear that Medicare Part D, as it stands, is truly not a benefit for Medicare beneficiaries. However, private insurance companies are seeing Medicare Part D as a great success. Humana, the second largest sponsor of Medicare private health plans, reported record-breaking profits of $302 million during the months of July through September alone this year. Yeah, exactly. That's exactly true. So Medicare beneficiaries really do need a prescription drug program that benefits them more than it does the private insurance companies. And that is why we've talked about the need for a Medicare-administered program. And we have actually some really great news to talk about today for some Part D improvements in the near future. Our own Senator Dick Durbin and Representative Jan Schakowsky, with the co-sponsorship of Senator Barack Obama and 5 other senators across the U.S., have recently introduced a bill that called the Medicare Prescription Drug Savings and Choice Act. And we're really happy to see that we have a representative from Senator Obama's office here today, Kathy Harrington, and Senator Durbin's office, Tim Sullivan, here with us today. leadership coming from our own state to talk about this issue. So I just want to talk a little bit about this legislation that has been introduced. It means it would create a Medicare administered drug plan, but it would be an option. So the private plans would still exist as they are, but it means that people who are happy with their current private plans would be able to keep them, but individuals who've had not a good experience with their private plans would have the option to choose a Medicare administered drug plan. And, this is really important because while one of the benefits of Medicare Part D now is said to be that Medicare beneficiaries have the ability to choose from a number of different plans, they're now denied the option that many of you want, which is the option of choosing a Medicare administered plan. Instead, there are numerous plans with different formularies and different premiums and different co-pays that you have to sort through. We believe that you should be able to simply present your red, white, and blue Medicare card at the pharmacy and receive the drugs that your physician has prescribed to you at an affordable price. In addition to being less complicated and confusing, a Medicare-administered drug plan would also save Medicare beneficiaries money, which Walter talked about a little bit earlier. Current law prohibits the federal government from negotiating for lower drug prices on behalf of Medicare beneficiaries. However, a Medicare-administered plan would have the ability to use the bulk buying power of thousands, perhaps millions of Medicare beneficiaries to negotiate with pharmaceutical companies for lower drugs, just like the Veterans Administration has been doing very successfully. A Medicare-administered Part D plan would also be cost-saving because it does not have to provide a profit margin for shareholders as these private insurance companies do right now. Like I said before, these huge profits, that's like the bottom line, the most important factor for private insurance companies. A government-run program wouldn't have to do that. The House Representatives Committee on Oversight and Government Reform recently released a report showing that the high administrative costs of Part D plans, and they said that the total administrative cost for Part D as it stands now amounted to 9.8% of the total cost of Part D. But if you look at the administrative cost of just Medicare, traditional Medicare, it's only 1.7%. That's a big difference. So we believe that the difference between the money you're going to be saving for not having to provide profit margins and being able to negotiate for lower drug prices, that should be enough to eliminate the donut hole, which is what we really is necessary in order to make this a real benefit for Medicare beneficiaries. When discussing the current state of Part D, it often becomes frustrating and disappointing. You're forced to sign up for prescription drug coverage, even if none of the plans really work for you, if you want to avoid getting these unforgiving late fees. So as Walter described earlier, a Medicare-administered drug plan would reduce this confusion and ultimately save taxpayers money. That's why I'm really excited about this piece of legislation. It shows that Congress has begun to recognize that there are problems with Medicare Part D that must be reconciled, and the leadership in Congress is coming from our own state, from Senator Durbin and Senator Obama and Representative Jankowski, who are taking action to make Medicare Part D a real benefit for Medicare beneficiaries. The timeline for this bill is still a little bit up in the air. Senator Durbin's advisor, Brian Hickey, told me yesterday that they do not expect the bill to pass through our current administration. So they're working on getting as much support possible now so that it can be passed as soon as we have a new president in office. However, he told me that the work of our grassroots efforts like ours are essential for this legislation to succeed. And if we can help get the Medicare Prescription Drug Savings and Choice Act passed, it will be a huge victory for the Medicare Task Force and for Medicare beneficiaries across the country. Now Medicare Task Force member Shirley Faulkner is going to tell you about the work that our Medicare Task Force has done and how you can get involved to make sure that this legislation is passed and that Medicare Part D works more for Medicare beneficiaries than it does right now for private insurance companies.
Good morning, everyone.
Good morning.
To all our seniors out here, I would like to say, isn't it nice to see young people working for us? Because one thing we know, they've got to go where we've been already.
Yeah.
We love you. Okay, my name is Shirley Faulkner, and I'm also a member of the Medicare Task Force. I want to take a minute to talk about the work that our group has done and how you can get involved in our campaign to fix Part D. Since we began our campaign in 2005, we have held 3 large community meetings to help Medicare beneficiaries in our community to navigate this confusing program that is Part D. We have also held press conferences and meetings with elected officials to let them know how problematic Part D truly is. When you go over to our action table, you will see one of our greatest accomplishments. We have collected nearly 1,800 petition signatures in favor of the improvements to Medicare Part D that Walter talked about earlier. These signatures are extremely important because they show how many people in our community are concerned with fixing Part D. We have collected these signatures by talking to family and friends, bringing them to meetings at our churches and other groups, and even setting up a table at the Urbana Farmers Market. In doing this, we have gotten the opportunity to speak with many people in our community and educate them on the urgent need for Part D reform. We have used these signatures in different ways. For example, when we met with Representative Johnson's office, we used these petitions as a way to persuade him to change his opinion of Medicare Part D, and that was something. 5 members of the Medicare Task Force had the opportunity to meet with Representative Johnson's health care advisor, Jen Mayshow, at the beginning of this month to discuss Representative Johnson's support for Medicare protections and improvements to Part D. By presenting these petitions to her, we were able to show that this is not a small issue and that fixing Part D is on the minds of nearly 2,000 of Representative Johnson's constituents. We were happy to hear that Representative Johnson recognizes the need for Part D reform and is pledged to vote in favor of improvements when suitable legislation arises. We have also used these petitions to show support. For example, when speaking to Senator Durbin's office about the Medicare Prescription Drug Savings and Choice Act, we offered to send him our petitions in support. Senator Durbin can use these signatures as proof of the need for a Medicare-administered drug plan and the number of people in favor of his legislation. We hope that they will be useful for him. We have more petitions at our action table in the back. I will be over there with some of my fellow Medicare Task Force members at the end of the meeting, and we encourage all of you to add your name if you have not already done so. You will also have the opportunity to sign a letter to Representative Johnson at our action table asking for his support, co-sponsorship, and vote in favor of the Medicare Prescription Drug Savings and Choice Act. We also have letters to Senator Durbin and Senator Obama thanking them for sponsoring this bill that could drastically improve Medicare Part D. Please come by and sign your names in support of this important bill. Finally, I would like to invite anyone who would like to get more involved in our campaign to attend one of our monthly meetings. They are generally on the 3rd Thursday of every month, although next month will be Thursday, December 13th, due to the holiday. They are held at 10:30 a.m. at the Illinois Disciple Foundation on the corner of Springfield and Wright. If you are interested in attending, please fill out a green sign-on form at the Take Action table, and we will make sure that you receive a mailing about our next meeting. Even if you are not a Medicare beneficiary now, I encourage you to get involved so that you will know what you have to look forward to in the future. Every taxpayer is paying for this program, and you will all have to use it someday. So fixing Part D should be a concern for people of every age. We appreciate all of you coming out today, and we hope that you will get involved in our campaign to fix Part D. Only Congress has the power to fix Part D, but we all have the power to call attention to the problems and advocate for change. Thank you very much.
Thank you, Sherby. Well, that pretty much concludes all of our presentations that we have for you today. So I thought I'd open up the floor for some questions if anyone in the audience has some. So I wanted to invite Katie and Andrea back up here if anyone had any questions, that way you guys can answer them. I'll just try and do my best to call on everybody. And I just wanted to also mention that this is mostly for general questions. So if you have a personal question about, the specific drugs that you're taking and what plan would be best for you, they probably require the help of some one-on-one time with a caseworker. So I'd encourage you to talk with Andrea afterwards and visit the table. So if you have a question, please raise your hand and we'd be happy to answer. I think I saw your hand first.
I don't know if this has been covered or if it's even known. What would be the premium, or monthly premium? Has that even been discussed for Medicare?
Oh, for the Medicare administered plan. They haven't actually, as far as I understand, the specifics have not been worked out yet. They were, in the legislation that I read, they were still trying to work out how they were going to choose the formulary and things like that. So their specifics aren't exactly set out just yet. Yeah, I think it couldn't be above the national average, which is about $25.
Oh, that would be, okay.
Yes.
Has anybody put together a matrix, a decision-making matrix tree to understand where, when one is eligible for some of these different subcategories of plans?
I haven't seen one. I don't know of one. Usually when people hear things by word of mouth or maybe a friend or something has it, then they usually call and find out if, are you talking about like the Illinois Cares RX things? Is that what you're saying?
Right, when people become eligible for some of these subset plans, because all of these words don't help one really understand that, and it would be most helpful to see a decision tree or a matrix so one can kind of follow this, an eligibility. You say in here, just because you receive a letter from Social Security saying you're not eligible, but still may be eligible here, but you don't give any, there's no clear-cut explanation of this.
They have it over here. I think it's closest to anything that I've seen, and for Rita, bless their hearts, we're good enough with, along with CCH, CC resources to help with this, and they're out of them, but I'm sure the yellow people would make that available. This is the closest that I've seen the tree that goes.
Actually, this is the premium comparison supplement.
Yeah, that
So this is a
doesn't apply to what
I know what
different.
she's talking, I think.
Yeah.
I think
Can I say something?
Yeah.
I think that, I'm sorry, I'm Claudia Lenhoff from the Champaign County Healthcare Consumers. And one resource that, that we found through our consumer health hotline, and Megan McClare is here who runs our hotline, is that you can go to a website called Illinois Benefits Checkup. And that's something that we've started to use with our clients. And it's a fairly friendly, easy to use website. And it isn't a matrix where you can look at it and sort of, but you can input information, and it lets you know whether you qualify for some of the state programs, and so it sort of takes people's information and then lets them know which of the different kinds of programs they will qualify for. And I think the reason that there's no matrix is because this is a mess, and I mean, this
That's why
really...
matrix is important.
Yeah, but it's really complicated because I think, as Katie said, first of all, Part D is a federal program, but not every state. In Illinois, we're actually fortunate that we have Illinois Cares RX, and our state is one of the most active states in trying to help people who are struggling with the financial burdens associated with Part D, but a lot of states don't have programs like that. But you can, there is good information on the web through the Illinois websites, the different websites. You can go to Illinois Cares RX, but sort of the simplest thing to use I think, for people is this Illinois benefits checkup. And it's not
But there's a
informed.
huge assumption there, and that is that everybody has access to the internet.
Well, of course, yeah, there's no printed mass distribution information, and part of it, and this is a problem, that's why I think when Andrea was talking earlier, saying, you know, if you don't have a computer at home, or even if you do, but you don't know how to access information, if you contact them, they can over the phone talk to you and get on the website and help go through that. So it is still limited, but part of the reason that things are so bad and that it is so computer-based right now is because, you know, this program was put out there, the Part D program was developed, it was put out there, there was really no thought about how to actually make it a benefit for people, and people are scrambling with the confusion, trying to sign up, trying to not incur benefits, and the states, as Katie said, with the Illinois Cares Act, are sort of put together on the fly, you know, to try to do the best, and I think we can expect for that situation to continue as things change, and so it's unfortunate, but I think the take-home message here is that if people want to try to get information to help themselves or help an individual, if you have computer access, try the Illinois Benefits Checkup, or if you don't or you're not sure, contact one of the organizations here, and Andrea's organization is top-notch, the best, and they figure out how to help people, you know, with a wide range of resources and so on. But yeah, it's terrible.
Thank you.
I
Yes.
wanted to ask about the Illinois Care RX. That there goes with just how much you make, how much money you make. If you make too much money, then you don't get in on it.
It's income-based.
That's what I thought.
But the good thing about that, though, is, I mean, some people, yeah, their income is not gonna change. But there's some people who, I don't know, I had a client that won the lottery, so he had like, you know, he was over income, but he's not gonna win that every year, so he can do a projected income for the next year, which makes him eligible, which is a good thing about Illinois Cares RX. So, you know, if things happen or change, I don't know, annuity runs out or something changes for you, you always have that option.
Well, they sent me that Illinois Care RX, but, you know, they seen what my income was, and then they just won't pay for your medicine at all.
One thing I'd like to point out with the Illinois Cares RX is that the actual printed income eligibility guidelines don't actually match what they are working off of. They passed an emergency rule last year to increase the guidelines to keep in line with the Social Security cost of living adjustment that come out every year in the new year. You get your letter in December, you know, and then in January the new amount starts coming. Well, they actually had a fixed income guideline to the Illinois Cares RX program that wasn't keeping pace with that adjustment, but they passed an emergency rule so that it would keep in pace with that, but they didn't reprint the materials or anything.
So they
So
didn't
if
update the
They
website?
didn't update the website, they didn't update their materials, so if you're close to the border of to being eligible, I would really encourage you to submit that application.
Okay. Just to touch on that a little bit, we do extensive training with Illinois Cares RX, and we have found out, because our governor did not sign off on a lot of the things, a lot of these grants, a lot of these programs, that if he does not sign off on this by January 1st, it's going to revert back to the original.
That
Got
won't
it.
take effect until 2009, is what I.
Well, yeah, well, I don't know, that's what they told us, but
It's
it is
confusing.
very
Send it in.
confusing.
Send it in, we'll see what happens.
Mitch?
If one is, this is for Andrea, if one is enrolled, has re-enrolled in circuit breaker, are they automatically re-enrolled in Illinois Cares RX?
Yeah, and that's a little confusing itself, you know, for instance, if you're reapplying for 2007, you take the information for 2006 for benefits for 2008. So next year, when you re-enroll, and then we heard that the application online and paper will not be available to the middle of February. Same encouragement, they encourage people to call an agency like ours and do it online. It's a lot faster, and it's easy. It really is. We do it for you, you're just giving us information.
What is the current motion?
Does Angela have a phone number?
Yeah, I have cards right up here.
Oh, okay.
Just the Durbin-Obama et al. Legislation that will create a Medicare administered drug prescription drug program will it allow Medicare to negotiate with drug companies to get lower prices?
Absolutely, that's a big part of it, yes. So I think that's one of the biggest reasons why the Medicare Task Force is supporting is that it actually touches on almost all of the things that we're calling for to fix Part D. 'Cause it does negotiate for lower drug prices, it's administered by Medicare, and it should not have a donut hole.
Follow-up, you gave the impression that the White House would veto it if it were passed by this Congress, so the action will be in the next Congress. Is
That was the
correct?
feeling from Senator Durbin's office when I spoke with them yesterday.
Do you know whether there are any other Republican senators or Republican representatives, in the country looking to support that? Is it drawing bipartisan support?
That might actually be a good question for Kathy. Do you actually know?
No, we don't know right now who stands where, but if it were to pass, we would need Republican support. It would have to be bipartisan without a doubt. Of all the things that the president has said that he was going to veto and has vetoed already, I doubt that they could probably get it through during his administration, and that's probably why they're holding off. The only way that I would see it actually becoming something while this administration is currently in office is if they have enough bipartisan support to override the veto. And I don't know if that's going to happen or not.
I think it's good you're making it an election issue in the next Congress. Congratulations on that.
I think it's also good to mention that when we spoke with Representative Johnson's healthcare advisor, when we met with her recently, she did let us know that there was a previous bill that went through about negotiating for lower drug prices, and the bill did not succeed, but Representative Johnson, who is a Republican, did vote in favor of that bill. So, there is, I think that's hopeful that, there will be Republican support for that. And Katie was saying that she thought that Representative Schakowsky's office was under the impression that they might vote even sooner than that. So maybe that might even be up in the air still. So that might be even more hopeful. Yes, sir.
Yeah, you have to realize that one of the most powerful special interest groups in Washington is the pharmaceutical industry. They were up right there with the gun lobby. What about, what's the cutoff for the Illinois plan in terms of?
For one person?
Yeah.
Hold on, let me get my.
How'd you know I was one? That's scary.
22,793. For two people, it's 30,594.
And it's the
which
combination
number
of
this is?
annuity and social security, is that the way it works?
Gross income.
Okay, but it's add these two together, right? Retirement.
Anything that generates income,
Okay.
we're talking pension, annuities, interest, self-employment, if you own any property, anything like that, that are gonna count.
The booklet that was distributed, is that all the plans that are available, or has there been additional ones?
For Medicare and me, is that,
Yeah, right.
I think is the, those are all the plans. If you're talking about Illinois Cares RX, as Katie said, there was some new ones added to
And
that.
not Illinois, but for the Part D one.
Yeah.
Those are, there's no additional ones, right?
Not that I know of.
Do we have any more questions?
I had a question for Katie, and I was sort of doing my job and taking photos and doing things, so I sort of missed this, but did you, in terms of talking about the donut hole, so in the Cautious Consumer Guide, it has a chart where it shows the donut hole for 2007, sort of where it starts and where it ends, and then for 2008, and it looks like the donut hole has gotten bigger by quite a few $100s. So that means that consumers who fall into the donut hole are going to have to pay out hundreds and hundreds of dollars more for their prescriptions while paying their insurance premium than they did last year. But did I hear you say that there are no plans in this area that include donut hole coverage?
There's actually no plan in the entire country that is a standalone Part D plan that has coverage during the donut hole coverage gap. So that is a real indication of the trend of increased costs for consumers in 2008. That's why we're really encouraging people to look at all the details, because problem with the donut hole last year, it's gonna be even bigger this year. Since the beginning of the program, the donut hole's grown by $1,000. And that's why we're really concerned about the Medicare Advantage plans, because those are the plans that can offer the coverage during the gap. And they also have all those other strings attached. You're railroaded into their health care plan as well if you want to get that coverage in the gap. So it's not a decision to make lightly. It's something to talk about with the trained counselor to make sure that your plan is going to meet all of your needs, not just those prescription drug needs. It's also just, yeah, the donut hole's a big deal this year.
She's wanting to know what plan is it that you can get into that won't have a dang donut hole?
That would be a more local question that Andrea might answer, because the Medicare Advantage plans are regional.
Does Medicaid get you past that?
Yeah.
Yes.
Because you're deemed eligible for extra help if you have Medicaid.
If your income cut off for that?
It all depends, because you have people that are just straight Medicaid and you have spin down, so that all depends on what it is.
Can you get it, and it's funny because I'm right on 10 with Claudia's question. What was the original rationale for putting in the donut hole? Was that simply a plan, and you're laughing, you're okay, because I don't understand, all of a sudden this started happening. People that I have known for years, all of a sudden, said that they were in a hole, and that's why, and we never did get a rationale for what was going on with it. Is that simply a plain subsidy?
I think that really what it comes down to with the donut hole is the basic structure of Medicare Part D was not designed to benefit consumers, people with Medicare. It was designed to generate profits for the insurance companies. They've got guaranteed customers with this program, and to avoid pharmaceutical companies from having to deal with a large group of people having the power to buy in bulk. The state of Illinois runs a Medicaid program that has a formulary of prescription drugs, and they negotiate on behalf of everyone on Medicaid. And they have a cost savings of like 20%. They reduce the cost of the drugs by 20%. The Veterans Administration negotiates on behalf of like 5 million veterans. They have a cost savings of 50% on the prescription drugs that they have. The Medicare Advantage, or the Medicare Part D program, there's 42 million people on Medicare, and they have managed to save only 8%. So this is a very expensive program that the federal government is subsidizing, and the only way that they could get it passed through this pay-as-you-go situation that we're in is to build in this huge hole right in the middle of the program and dump all the costs onto people with Medicare instead of having a real benefit that is designed properly.
And another question, is it possible, in other words, if you are Medicaid eligible, there are probably people in the room that don't know that they are, and of course feel that this is horrible to have to go to, but we're at the age here where I'm seeing people in my entire neighborhood that are making the choice between eating and paying their drug costs. Now, while you're thinking of what the Veterans Administration has been so effective, is there any way for people like you and Claudia and other very gifted executive directors to direct our efforts to go in tandem with the Veterans Affairs Department, because they've already done this, so that you kind of don't have to reinvent the wheel? Been there. Is there any way to get on board with them so you folks aren't taxed to try to do this?
I'm sure that there's creative solutions out there. I've noticed in the media that the city of San Francisco is providing health care to their own people. But I would really say that as a country, all of us taxpayers are paying for this huge program that's out there, and we need to make it work. We don't need to have our own program that works. I'm sure that we can work with the people that can make the changes in Congress and turn this into a good program. There's legislation out there that we can actively support, and I think that it's really hopeful that even though this is a mess right now, it could be something good that we can all celebrate and want to sign up for.
I thought that was a great answer. I wanted to make sure that we can get back to the lady's question though about the local Medicare Advantage plans. Just some of the, I think you're just looking for some of the names of programs that are, of some of the plans available in this area, right?
The Health Alliance has one. Yeah, the Advantage plans are listed as Medicare, you and me. Like Katie said, you just have, if you go out of town, you just have to be aware, because what it does is it absorbs the Part B Medicare. And if you go out of state and God forbid something happened and you were in the hospital, that hospital has to say, or the clinic has to say, we accept this insurance. If they don't, you're paying for it out of your pocket, because essentially you don't have it anymore. Okay, so that's the part that you have. If you don't plan on going anywhere, if you're here, this is where you're at all the time, then that's fine. Right. And that's fine. So you have to look at all those different things when you're looking at the Advantage plans.
Victor, I think you had your hand up.
A clarification then, if I'm understanding your explanation, if you're eligible for Medicaid, the donut hole is a moot situation, is that correct? Okay, then, in my logical mind, I would love to have the gross income levels the same for Illinois RX Care and Medicaid, or...
Well, Illinois RX does cover a percentage into the donut hole. It's like 20%.
Yeah, but I want to know, what are the income levels that make you eligible? Is it the same as making you eligible for the Illinois RX Care?
No. It's much higher for Illinois Cares RX than it is for Medicaid.
Okay, so how does one find out those income levels?
That's something that you could call us about and we can talk to you about, because there's different things that go on when you're talking about Medicaid, especially when you have people who own their own homes, because the state can put a lien against your home if you are on Medicaid. Okay, there's different things that have to go along with this. There's assets, all different kinds of things. So if you're interested, feel free to call us. We can come out to your home, we can sit down and talk to you about all of that.
I was just gonna say, like Andrea's saying, with Medicaid, it's not as simple, like with Illinois Cares RX, you can kind of look at an income guidelines chart and figure out, qualifications and so on, but with Medicaid, it takes, as Andrea's saying, it takes into account, not just income, but all kinds of assets and household size and stuff, and it's really not easy to just find information.
It's not real clear cut.
Yeah.
Kim, I think you had your hand up for a while. Did you still have a question?
I was wondering, Andrea, when you talk to clients about eligibility for Part D, do you help them select a plan, or just, fill out the paperwork?
We go over it with them, and like I said before, I really encourage family members to be. If they're not there, then that's okay. If you are with me at a computer and you give me permission to enroll you into a plan, I can do that. Now, if we're over the phone, I cannot do that because of liability reasons.
What website do you use to try to help people select a plan?
Medicare.gov.
Okay, does that have some kind of decision-making process then?
You can go in, you can put, like, say you have a list of your medications, and you come in, you go, okay, Andrea, these are all my medications. We're going to put it in, and it's going to bring up all the plans that cover your medications and what the cost of it is, the premium, if there's any premiums, if there's any deductibles. Then we go from there.
I would just say to that effect, one of the things that we've talked about a lot today is the Medicare Advantage plans and being aware of those. On the website, of course, they don't call them Medicare Advantage plans. They're called Medicare Health Plans. So if you're on the website and trying to use that, be aware that Medicare Health Plan means Medicare Advantage. And on the website, they really seem to be directing you into just looking at the premium cost when you're making your decision. But go a step further that Andrea was talking about, and once you narrow it down, make those phone calls and find out the details of each plan. Don't stop at just looking at the premium.
It doesn't give the prescription cost, it won't calculate it, will it?
It does.
Some of them do. Some of them do break down the prescription cost.
But isn't there variation among the different drugstores?
Yes.
In terms of price? So
And that's also on there as well. If you could bring up the drugstore the pharmacy, and it will list those also for the prices.
So you have to go through all the various-
Yes, it's very tedious. But I mean, if you're
That's why
really
you're-
wanting to know what's best for you, then, you know, that's what you have to do. I mean, we as consumers, we put a lot of trust into other people a lot of times. And sometimes we get burnt because we do that. So we have to take the responsibility of ourselves and try to find out those things that are really, really gonna affect us.
And that's why they send us all of that garbage.
Sure they do, sure they do. And you know what, I tell all my clients, give me a call, and I'll sit on the phone for literally an hour and go through their mail. I say, toss it, save it, toss it, save it. And when I come out, then I go, I say, well, what's the best amount of time to keep mail for? And I say, anything that comes from the state, 6 months to a year. And the rest, that's my own person, because every time it seems to come back up, well, let's pull that out. You know, we had that 6 months ago, let's pull it out and see what it says. So you just have to, you know, it's tedious too, but that's what they do. This is the time to sell.
Claudia, you had something?
I just wanted to point out too, though, that part of the travesty of this Part D plan is that, you know, it takes an incredible amount of work by the individual, the family member, the helping organizations, to try to do as systematic an analysis as possible to figure out the best possible plan. But so it's really not a benefit. A benefit, you know, should be that you take your Medicare card and you go to the pharmacy, and you know, and you're not having to spend, you know, 2 months worth of homework and crunching numbers. But even if you do all that work, and I salute the people who are able to do that, you know, part of what's so atrocious about this is that you can select the plan that seems the best for you right now based on your prescription drug needs. The fact of the matter is that, you know, your prescription drugs may change. Your physician may change the drugs that you're on. Maybe one that's been working for you becomes less effective, or you put on some weight, or you lose some weight, and you need to have a change in your prescriptions. And then all of a sudden that plan doesn't work quite as well for you because you didn't plan for what other drug might you need. The other thing is that you make your decisions based on the information that you get at the time, but there is nothing in the law preventing the insurance companies from constantly changing the formulary. So the formulary that you saw, that you based your decision on, you know, my drugs are in tier 1, this makes it affordable to me, you know, I can afford the cost at the pharmacy, I can afford the premium and all that. It can change, they can change it every day if they want to. And that's part of what's horrible and what we've seen from a lot of people. They did their homework, they chose the plan that was the best, and then a few months into it, all of a sudden, the drug that they've been getting for a few dollars now became, you know, unaffordable. And that's part of, you know, what's so problematic about Part D is, you know, there's all the rules and the constraints are on the consumer, and all the burden for making decisions is on the consumer. But in a way, it's false, because what you're getting when you make a decision is a snapshot of that plan, you know, that isn't necessarily going to stay the same for the whole year. I'm sorry to be a downer and say that, but I think that, you know, I think that again, this is part of why people may want to have, you know, get their prescription drugs through a Medicare, you know, administered plan.
Bait and switch.
Right,
I mean,
exactly.
that's what Amanda did, was bait and switch. It was a low thing, and all of a sudden they kick it up way, they kick it way up.
That's right.
Exactly, and I think, and people's experiences with this is how we thought of all the consumer protections that we feel are necessary in a benefit, that the formularies have to be fixed, and that, you know, your co-pays have to be fixed. And these are things that people in our Medicare task force were experiencing themselves and brought them up, and that's how we do these things. And I'd just like to add on that, you know, that's exactly what we're talking about in our petitions, and I encourage everybody who just realizes this is such a travesty, this does not make sense. Please sign our petitions and join our task force, because this is not a true benefit for Medicare beneficiaries, and we need to work to try and fix this. So I think Walter was first.
Would somebody please explain to us what a formulary is and what function it has?
Sure, well, a formulary is the list of drugs that your insurance company will cover, and they're in tiers. Well, I mean, I guess maybe when you guys could list out the tiers better than I could, because I don't know.
Well, there's, from one of the last time I looked, I thought there was 3 tiers, the lowest being 1. like generic drugs and things like that. And then second tier is the medium level drugs, and then you have the brand name drugs that are usually in level 3, which are.
And they're all in alphabetical order,
Yeah.
easy for you to find.
Yeah, and they also, whatever sister medicine it is, they're usually all there in one listing.
It's a big list, and in addition to just the names of the drugs, it also should include the dosages and any quantity limits that might apply to the medication. And so a formulary lets you figure out which drugs are going to be covered by that plan. But even if a drug is on the formulary, it might be there and require some step therapy to get to that drug on the formulary. So even then, you really need to understand the whole plan before you can really understand what that formulary is telling you, the list of those medications.
I have a slightly alternative definition of a formulary. It doesn't contradict what they've said, but a formulary is an invention of the insurance companies. It's a way for them to figure out how to minimize costs and increase profit by categorizing drugs based on, the actual cost of the drug to pay for it, how commonly it is used, and that's why it's constantly changing. The formulary is constantly changing. It's not based on, it's not like Katie said earlier, now there are some plans out there that actually charge $75 for a generic. What was the whole point of generic? The whole point of generic was that the pharmaceutical company, that their patent expired, and now this medication could be made by a bunch of different companies, thereby making it more affordable to everybody. So formularies are an invention of the insurance companies for figuring out how they're going to pay out for different medications and make the most profit and cut the most costs. And that's why one day you can have a medication that's on tier 1, and then all of a sudden it's on tier 2. And what changed? Probably what changed is getting more widely prescribed, and they said, aha, we can shift the cost onto the consumer so that we're paying less and they're paying
So
more.
it's an instrument of profit.
Yes.
Bless you, Claudia.
Okay, I think we're just gonna take a few more questions because it's getting kind of late. I think people are getting antsy. It's getting close to noon. So, and we'll take these last 4 questions. If that's okay, so we'll start over here with Maggie.
I was just going to be clear, when you talked about the different tiers, so one would be like a cheaper prescription drug, right? And then with the increase in the tiers, it's a more expensive drug.
The tiers relate to the co-pays that you'll pay at the pharmacy, correct?
Okay, just
Great.
I was just hoping you could say one more time how to get involved and what to attend if you want to help fix Part D.
Great, yeah, if you guys want to get involved, our meetings are once a month. They're always the 3rd Thursday of the month, and they're just in Champaign on Springfield and right at the Illinois Disciples Foundation. And if you are interested, I realize that we don't have the sign-in forms. I must have forgotten them in the office. So, please just write your name down at the take action table, put a little star next to your name on the petition, and we will make sure. But I think we're going to send the mailing out to everybody who signed our petition, so everyone should know about the upcoming meetings. We'll be having one on the 13th of December, and I encourage everybody to come. Great. And you ready? Yes.
A clarification on the kineticness of Plan D. The formulary can change, therefore the co-pays can potentially change. But can the monthly premium also increase during the consigned year?
I haven't heard of that. I haven't heard of the premium changing.
I have.
Great. Next question.
I'm trying to, give people information before they leave, because I've fallen through the cracks, and I was inadvertent because I went to a scheduled meeting, because I had certain drugs that I didn't know were going to pop up, was given information on how to change the program, and I fell through the crack for 7 months. It took me 7 months to go back out. In a deal like that, where you've got misleading information, SHIP, who these people know about, will help you get back out without a plan administrator or a late fee charge in case you've gotten into something that you feel there is not quite what you want. Secondly, and as an RN, I've gone to CVS where I go for my own drugs and told them that we do not want to substitute anything out of this country or Canada for filling the drugs. They're switching, they're charging the plans here in many cases first-rate premium costs as if they're being filled in pharmaceutical companies in this country and going to places like India, which is correct, for diabetic drugs, which has no quality control. So you have the right to tell your pharmacies and pharmacists, and that's part of the swindle here, the bait and switch going on. They're going in there and changing monthly sometimes when you fill to other lesser or third rate.
Okay, so, yeah, I think that sounds great. Okay,
And last thing, I found also it's cheaper if you fill for 3 months because they charge a dispensing fee. So sometimes you save money if you fill for 3 months instead of monthly.
okay, okay, well, Larry, thank you. So that's everything. Thank you so much, everyone, for coming. Please take a few minutes to go around to the tables and sign our petition. And, if you want to take a coffee or a donut with you, please feel free.